Assalamu alaikum friends. Today I am going to talk about the NSAIDs. The NSAID is actually the abbreviation come from the non-steroidal anti-inflammatory drugs. These are the drugs used to treat the pain, fever and inflammation. So first I am going to talk about the mechanism of action of NSAIDs. Then after I shall discuss the various NSAIDs which I have listed here. So the main inducer of the pain, fever and inflammation is the prostaglandin, and the prostaglandins are produced from the arachidonic acid by the enzyme cyclooxygenase 1 and 2, and the arachidonic acid is produced from the membrane phospholipid by the enzyme phospholipase A2. So the NSAIDs are actually inhibit the COX-1 and COX-2. When these enzymes are inhibited, there will be no formation of prostaglandin, so there will be no pain, fever and inflammation. So to inhibit the cyclooxygenase 1 and 2, there are two groups of NSAID. The first is the non-selective NSAID, the second is selective NSAID. The non-selective NSAID inhibit both the COX-1 and COX-2, and the selective NSAID inhibit only COX-2, which is expressed during the pathological condition, and the COX-1 is expressed during normal physiological state. So the selective NSAIDs are the celecoxib, the rofecoxib and the valdecoxib. The celecoxibs are actually using nowadays, and the rofecoxib and the valdecoxibs have been drawn from the market. And the non-selective NSAIDs are diclofenic acid, the ketodolic, the phenopropane, the flurbipropan, the diplonisol, the ibuprofen, the ketopropan, the endomethacin, the ketorolic, the mepanemic acid, meloxicam, pyroxicam, naproxen, oxaproxen, solendec, tolmetin, etodolic, and aspirin. And the main difference between these non-selective NSAID and the aspirin is that the aspirin actually inhibit the COX-1 and COX-2 irreversibly, while these NSAID inhibit the COX-1 and COX-2 reversibly. So this was all about the NSAID. So thanks for watching the video.